To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, welcome to Your Health. Today we're going to talk about some non-surgical options for pain relief because I'm joined by Erica Dean from OSI of the Fox Valley. Hi Eric.
Hey, how you doing?
I'm doing good. I'm glad you're here because a lot of people do struggle with the hip pain, the knee pain, the ankle pain, and the first thing we think of is, I have to have surgery.
Absolutely.
You have a lot of options to maybe replace that or at least prolong, right?
100%, and you hit the nail right on the head. Most patients that come into my office as a new patient or even an existing patient that's seen multiple different practitioners in the past, they come into my office expecting that surgery is just the only option, and it's just not the case. Let's take, for instance, the knee, okay? The most common orthopedic condition in the country affecting 1 in every 4 Americans, and there is just a lot of options, some of which are traditional things like cortisone injections. A lot of people have heard of cortisone shots, world's most powerful anti-inflammatory. It works really quickly, but doesn't last very long. There's also other things like gel injections, what are called hyaluronic acid injections. These things are fantastic because it's a pure lubricant for the knee. Think of it as the world's best oil change for your knee. It's not an anti-inflammatory, it's actually an all-natural substance that's supposed to be in the knee. I'm just supplementing what you may not have. Those are once a week for 3 weeks, and they usually work for at least twice as long as cortisone, which is fantastic. There's about 5 or 6 different categories of injections, to be honest. There's the cortisone, there's long-acting cortisone, which are specifically geared towards diabetic patients. There's the gel injections like we talked about. And then there's other modalities such as bracing and physical therapy. Those are always a mainstay in orthopedics. But what I'm really passionate about is delivering non-surgical options for patients that are maybe looking to avoid the operating room.
Yeah, in our last time here, you kind of got me all excited about you can actually freeze the nerve or shut it off to stop that pain.
It's one of the coolest procedures that I do. And I was privileged enough about 8 years ago that this was introduced to me in its infancy. It's been around for about 13 years. I had my hands on this about 8 years ago. And what it is, it's called IOVR cryoneurolysis. And what cryoneurolysis means is it's just shutting off the light switch of the nerve that's feeding the knee, the hip, the shoulder. Specifically for the knee, I do most of them prior to a knee replacement. So what I'm doing is I localize these nerves under ultrasound, deliver targeted cold therapy right to the source, right at that nerve. And it effectively shuts off the light switch to the nerve, which cuts off signaling back to the brain, which reduces pain. In the instance of total knee replacement, okay, statistically this cuts pain post-op in half. So that's half the amount of narcotics, half the amount of medications that a patient might have to take, which has been fantastic for us.
Well, Eric, thanks so much for all these great non-surgical options, and we want to thank you for watching To Your Health.
The preceding was a paid advertisement.